Hello, Kidney Warriors! James here from Dadvice TV, your online kidney health coach, and this is Dadvice TV Live. Now tonight, we've got a monthly regular here to do live Q&A. But for those of you, before we get into it, those of you that are new, let me quickly introduce myself. My name is James. I'm a kidney warrior, a kidney patient like so many of you out there. And I have learned that by working closely with my healthcare team, my doctors, my renal dietitians, I was able to fight my way against kidney disease, kind of quiet down all the symptoms that I had, and slowly make some improvements to my health. Now, I didn't fix my kidneys. They're shot. They're never going to physically get better, but by eating the right foods for my body, by staying active, by doing all the right things that my healthcare team told me to do, I was able to greatly improve my quality of life and delay the need for dialysis. And that is just so important to have that freedom. Now, as kidney patients, one of the most important things you can do, and this is something that took me a bit to learn in the beginning, was work with professionals, especially when it comes to your diet. A list of foods to avoid isn't going to work. Following what someone else eats, that's not always going to be the right thing for you. The right thing is working with a renal dietitian so that your diet and the choices you make are individualized for you and your health. And you learn so much about food choices and how to make great tasty things that you will enjoy when you work with a dietitian. So tonight, that's what we're going to do. We're going to talk with the most popular renal dietitian here on Dadvice TV. Please welcome, so she can introduce herself and tell you all about her wonderful and amazing Facebook group and website. Please welcome, from plantpoweredkidneys.com, renal dietitian Jen Hernandez. Hey, Jen.
Hi, James. Hi, everybody. So happy to be here yet again and have an excellent live Q&A chat with all of you. Like James had mentioned, I am a renal dietitian and I'm board certified in renal nutrition. I've spent the majority of my dietetic career working with people who have kidney disease. And in that work is where I really developed the interest to help people even beyond where I physically was by creating Plant Powered Kidneys, which is our website, our online virtual private practice, and where many people go to get information about a plant-based diet that supports kidney health. So besides our website, we also do have a free Facebook page or free Facebook group. We have a free Facebook page too, but we have a free Facebook group for you to join if you're looking for a community of like-minded people who want to increase their foods, add more plants to their diet, and continue to protect their kidney health along the way. So you're more than welcome to join that group and just be a part of that positive atmosphere and community. And if you are looking for more information about a renal diet, working with renal dietitians, all that good stuff, you can go to our website, plantpoweredkidneys.com, to learn more. And I'm just ready to get talking with everybody tonight. I love seeing the names. I've been emailing some of these people today. They probably don't know, but
go ahead. It's wonderful to see all the regulars coming back.
Yeah, exactly. So that's really, really fun. And I'm very excited for our Q&A.
Now, for everyone out there, if you have a question, we are live. It is Tuesday the 5th of September. Oh, it's September already at 7:05 p.m. Eastern. We are live. So go ahead, type in your comments down below, and we're going to go through and try to answer as many of these as we can in the next 25 minutes that we have left. And our first question comes from Teresa. She says, how much bread can you eat? And she's so polite. She says, please.
Please. Well, of course. Well, first of all, bread is absolutely something to include in a renal diet. I know some people demonize bread, or they say, oh, you can't, it's carbs and all of that. let's ignore that. Okay. Bread has a lot of great nutrients, and those whole grains, those carbs are actually a very important nutrient for our health, not just kidney health, but our overall health. So when you want to add bread to your diet, there's a few things that I recommend looking at. Number one is sodium. That's probably one of the biggest things because bread can be secretly salty. We don't realize it. We don't really taste that salt the way we would taste it in other foods, but bread can be very, very salty. And I want to expand that to like all of the bread products like rolls and different types of baked bread food items. Those can be higher in salt. So make sure you look at the sodium. Aim for something that is on that low sodium side. Under 140 milligrams per serving is ideal. And you can actually find quite a bit of bread options that are on the lower sodium side. And I'm not talking about the ones that are no sodium, because there are some out there, but they really do taste like no sodium. So if you enjoy that, then go for it. But know that you can find a lot of other breads that are on the low sodium side, and they might not even advertise it. They might not even market it, but it could still be low sodium. So check the labels for that. Another thing to look at is whole grains. The old renal diet was all about doing white bread, white grains, white rice, and avoiding the whole grains. But now what we know are the nutrients that are in whole grains are so good for us. And I say us as in all stages of kidney disease. So it's important to get whole grains in our diet. One of the things that has since been outdated is this phosphorus concept. There is phosphorus in whole grains, but the phytate that is in relation to the phosphorus in the whole grains, it's something we can't break down. Our bodies don't have the enzyme that breaks it down, which would release the phosphorus. And because of that, the phosphorus is not going to be absorbed into the body. So that's why whole grains are a better option for us. Our body just fortunately can't break that down. So looking for whole grains as the number one ingredient. Whole wheat, whole grain products, that's going to be the number one choice of bread that I would be looking at. Not to say you can't have a nice classic slice of white bread, but try going for like half of your grains. Go for the whole grain option when you can. So that's another thing to consider. And then finally, I would say fiber, and that's kind of in the same category of the grains, but that's why I want to promote those whole grains, because the fiber in the whole grain is what helps nourish us. It keeps us satisfied. It helps us feel full, and it helps our healthy gut. So it helps feed a healthy gut so that we can digest really well, which helps get rid of those toxins that we're focusing on eliminating and giving the kidneys less work. So having a healthy gut and feeding that healthy gut is really, really important. So those are some of my top tips when it comes to finding a bread that'll fit into the renal diet. But just so you know, like most things, we do have an article all about it at the Plant Powered Kidneys website. So you're more than welcome to just go to plantpoweredkidneys.com and search bread, and it will pop up.
Yeah, and there are links to the Plant Powered Kidneys website and Facebook group all in the description of this YouTube video. In case you're later on in the broadcast like, oh, what was that link? It's in the description. You can come back, rewatch this, click on the link, and so much great information out there. Now the questions are rolling in. Yay, yay, yay. There's a couple that really stood out to me. Michael says, can't tolerate cooked vegetables at all. I feel for you, Michael. That used to be me. Can most vegetables be eaten non-cooked, raw? And he's stage 3. He's wondering, is his future all salads?
Oh, I feel for you, Michael. I get it. The first time I had Brussels sprouts, and Mom, Dad, I'm sorry if you're watching, because they watch. But I will always remember when we first had Brussels sprouts and they were steamed, and I just thought that same thing. Is this my life? Like, is this what I'm going to be having? And I was not a fan of steamed Brussels sprouts, but I am a big fan of raw shredded Brussels sprouts. Yes, for a salad. But I'm also probably a bigger fan of roasted Brussels sprouts. So I'm saying this to tell you that just because you don't like a vegetable prepared in one way doesn't mean you don't like it at all. It's just that type, that variation that you might not be interested in. And yeah, there's probably going to be vegetables that you're just not a fan of, no matter how they're prepared, cooked, raw, whatever the case is. You do not have to eat every type of vegetable that's out there. The great thing is that there's so much variety. There's so many different types that you can still have a good variety in your diet, even if there's some that you don't enjoy. But I think it can be really, really helpful to, of course, do some salads if you want, or you can load up vegetables on, let's say, a sandwich. You can make like a nice loaded veggie sandwich and add some hummus to it to give it that filling plant protein and fiber you need. But you could also do something like a soup or a stew, and you can add them in there, and maybe that type of cooking, that might be something you enjoy, and the flavor in the soup might be something that you think is worthwhile. You can even blend them into a soup so you don't actually taste like a piece of cooked vegetable, but you make it into a creamy vegetable base, and maybe that's something you enjoy. Think like a tomato soup, something like that, or even potato soup or broccoli soup that can be blended into a creamy base. Another option, like I mentioned, is roasting. So you can do roasting, you can do air frying. There's tons of different cooking methods with that. And it's really eye-opening once you start thinking about all these different avenues. And James, you and I have talked a lot about these different cooking methods and eating methods.
Yes, and I wanna plug my favorite air fryer secret that I learned was radishes, and Jen's the one who introduced me to this. First, I love radishes. I can eat them like an apple, just crunch them. But I cooked them in the air fryer. I just chopped the edges off and put them in the air fryer. It's like 400 for 12 minutes or something like that. And oh my goodness, first of all, they taste completely different. I swear, I'm eating potatoes. It tastes like little tiny baked potatoes without, worrying about how much carbs I'm getting. But absolutely delicious, and spices and things you can add to it. It has just been amazing. And I love my air fryer. I used it tonight too.
Yeah, that's such a great example, and that's a really classic one where you think about how drastically the vegetable changes, and you would have had no idea, right?
Mm-hmm. Yep. All right, here's a good one. Now, it's not exactly diet related, but I know a lot of people have this challenge. Pina J says, "Hello. What advice can you give in order to have your nephrologist listen to you? He feels like he's not being heard, and there's no sense of urgency in putting together a plan for him."
Yeah, I get this. I have heard this a lot from clients, patients, a lot of people just emailing us too and letting us know that that's kind of their experience. And I want to say I'm sorry that you don't feel like you're being heard. Your situation is just as important as anybody else's. And it's unfortunately, a lot of times it's just the medical system that we have, and it's to no fault of the doctors per se. I mean, there are some doctors that maybe have different or better bedside manner than others. But honestly, there's a lot of overworked nephrologists, and something that I like to put into perspective, and again, not to, I'm trying to think of the right words to say this, but I'll carry on with this example. So nephrologists cover everyone from early stage, well, mild, moderate stage. They don't usually get referred to early, so it's more like stage 3 maybe, but stage 4, stage 5, into dialysis, and then through transplant. And I'll tell you, the majority of their patient population is probably going to be the the dialysis population. And there are some very, unfortunately, sick people in dialysis. And there are emergent cases, and there's people that are getting amputations, and just all kinds of really, really hard things that are going on medically. So when a nephrologist is looking across their patient panel and they have somebody like that, and then they see you, that maybe you're not going through those things and you're in earlier stages, that they're like, oh, this is, you're good. Like it's okay. This is fine. And because they see that kind of broader picture of the patients that they have. But again, it's not to say that your situation isn't bad. In fact, you're probably the unicorn, because you are coming in with more consider, you're looking at your diet, you're looking at your medications, you want to make changes. And that's not the majority of people. The majority of people, and you may talk to people in your life that go to their doctor's appointments and they just kind of say, oh, I have to go to the doctor, and that's it. Like, they don't put thought into it. They don't want a plan. They're not thinking about all of this. You are putting that effort in and making that plan. And that's really, really different. And so in some cases, you might be at a stage, an earlier stage, where medically there may not be a lot to do, because a lot of the medical side of CKD is towards dialysis and some medication adjustments and transplant. And that's, again, that's later. That's down the road, stage 5 kidney failure through transplant. But if you're coming into it earlier, you might need to be looking more at the nutritional side. And of course, I'm looking pretty biased at this point, being a dietitian, but I'll say that nutrition is incredibly preventive, and talking with other people about it, you'll probably hear the same thing, irregardless of CKD or not. But just looking at nutrition can be really, really powerful, really, really helpful. And your doctor, unfortunately, is not the one to provide that kind of information. That's just not what they're trained on. That's not their background. That's not what they went to school for. They may have taken one general nutrition class, nothing renal specific for sure. And so they're not armed with that information to help you. So my recommendation is to, when you're in these earlier stages, to shift the focus and shift the conversation with your doctor about getting a referral to a dietitian. Ask them to grow your healthcare team and to get a nutrition specialist in your rotation so that you can spend an hour plus talking about your diet and talking about preventive measures and what can you do, what kind of improvements can you make. That can be really life-changing. And James, I'm talking a lot tonight, but I know you have a great perspective about this too.
Yeah, and the one thing I love to remind other kidney patients about nutrition is the one thing we have control of that our kidneys don't take from us. I can't control my creatinine. That's just my body's creating it. My kidneys are filtering it at a certain level. But I can control through my choices of what I eat how hard my kidneys have to work to try and keep up with me. And the way I see it is I've used nutrition as a tool to reduce the burden that I place on my kidneys. I'm not giving them too much. I'm not pounding them with so much sodium like I used to do. I'm about 1,600 milligrams a day, and some days it's very difficult, especially if my kids are like, "Oh, Dad, let's have pizza," and there's a really good pizza. I'm like, "Oh, each slice is like half of that." But the one thing I have control over what I get to eat, and that actually makes me feel good, and it's almost like a challenge. What can I do to make this taste better, give me more nutrients, more of the things I need and less of the stuff that I don't? And everything that Jen just said is spot on. All right, let's get to another question. Here's a couple good ones that I'd love to get in here. Richard asks, can he still eat peanut butter? And we've talked about peanut butter before.
Yeah. Oh, thank goodness we can. Yes. Peanut butter, absolutely. Think of, let's expand it into just nut butters in general, because there's a lot of options these days. So yes, it's absolutely something that you can include in your kidney diet, as long as you're not allergic to it or you don't hate it. So basically, if you want to have it and it's safe for you to have, as in your body's not going to physically tell you you cannot, then that's going to be okay. The things that people think about when it comes to peanut butter or nut butters with a renal diet, again, phosphorus, again, outdated. So we're not paying attention to that information anymore. Phosphorus in whole grains, nuts, seeds is not highly absorbed. So that is not a consideration. We're looking at maybe potassium, because it is a nutrient-rich food. A serving size is 2 tablespoons. It's not very much. And it can be a couple hundred milligrams of potassium, which still can be low potassium. But if you're going to be heavy-handed with that sandwich or adding it into oatmeal or a smoothie or something, it is something to consider if you're on a low potassium diet, which not everybody has to be. because the kidneys can be really, really good at taking care of potassium, but your gut also takes care of potassium. So if you're eating really well, if you're giving your body those nutrients and feeding a healthy gut, that will help take care of your potassium as well. And if you are on a potassium restriction, try not to aim for the 0 milligrams potassium, because that's also not going to help your body, and you're going to starve yourself of not just potassium, but other nutrients that are very important to you. So the name of the game is not how low can you go, it's how much can you have. That's the name of the game. So wherever you're at with your potassium, that's a big part of it. A couple other things when it comes to nut butter is, again, the added salt, because some companies will put salt into their nut butters. And then added sugars, because there's like the sweetened kind, there's like honey flavored or chocolate, or, all different kinds of good options. But they can have added sugars, and that's something else to at least be mindful of. It's not that you can't have any, but it's how much are you getting and where are you getting it from? And we want to make sure that we don't have too much added sugars. The general recommendation is no more than 10% of your calories coming from added sugar. So a regular 2,000 calorie diet per day would be about 200 calories coming from sugars, for example.
Very good. Now, Rita asked, and this is a great question because this is something we don't talk enough about, in my opinion. It's like one of those little secrets for dieting and staying healthy. It's fiber. What are some good sources of fiber for those with CKD?
So when I talk about fiber in the diet, I'm talking about food. I'm not talking about supplements. I know a lot of people like the idea of taking a fiber supplement because it's easy, but if you have to take a fiber supplement, then I hope it's because you are on a gut-specific protocol that's being followed by your healthcare team, and that your dietitian is like ready and waiting for you to come off of this fiber supplement. Because in general, we do not need fiber supplements, especially when you're getting a plant-based diet into your life. So great sources of fiber, definitely, like I said, whole grains. So I'm talking about whole grain breads, whole grain pastas, whole grain cereals, that whole gamut. Those are going to be great sources of fiber because whole grains have fiber naturally in them. Other sources of fibers that I really love, fruits and vegetables, a wide variety, tons of different options. Some of the highest fiber are like raspberries. I think there's about 9 grams of fiber per cup of raspberries. So that's an easy way to get a huge amount. And for the record, we're looking at 25 to 35 grams of fiber per day. So 9 grams of just with raspberries is awesome. You'll also find fiber in nuts, beans, seeds, legumes, basically plants. And so adding more plants to your diet, you will automatically be adding fiber. And don't be fooled if you see something that has, only 1 or 2 grams of fiber, because it does add up. And again, we're only looking for the minimum 25 grams per day. I will tell you, my students, my patients, my clients, they easily hit 40 plus, even 50 grams of fiber per day. And it's consistent because they follow a plant-based diet. And the other thing I want to add on to that too is to not go crazy with fiber right away. If you're not used to eating fiber normally, exactly, you need to gradually increase, because your gut will rebel. Your stomach will not be very happy if you go from 10 grams of fiber per day up to 30 grams of fiber per day. So go slow with it. Add it gradually, let your gut get used to it, and then you'll be familiar with it, and it will be able to tolerate those higher amounts of fiber. And that's the sweet spot. That's where you want to be, where your gut is used to taking care of all these nutrients and chugging right along.
Perfect. Now, here's a great question from Queen of Weaves. Hey, great to have you here with us. I think this is our first time here. She asked, what's a good seasoning besides Miss Dash? She's making her own seasoning blend, and she's looking for a good substitute for salt.
Well, there's actually quite a few that are out there. Flavor God is a great brand. Chef Prudhomme is another really well-known brand that's been out there for a while. Just in general, herbs and spices. So I'm thinking very basic, like cilantro and cumin and parsley and oregano and thyme, all those kind of classic spices that you have, those are naturally sodium free. and you can mix them and match them however you like. But there's some that go really, really well together, just the way that they've been used historically. So we think of like Mexican and Spanish spices like cayenne and cumin and paprika, of course, onion and garlic, maybe some jalapeno, or because that's still kind of a spice. It's some more flavor that we have. And then we have Italian spices. We have oregano, we have thyme, rosemary, marjoram, a lot of different varieties there. So you can definitely look up online to see different spice blends that are out there. And there's so many options of like making your own spice blends. There are great options in the stores like Dash that you can get that are kind of pre-mixed for you, but it's fun to play around in the kitchen and just see what kind of flavors you like. Try one or two at a time, add them in, take them out, whatever works for you. It can be a really, really fun way, again, kind of tying back into that vegetable conversation of finding a good diet that is really flavorful to you and that you truly enjoy, because that's the point of making this change, is finding the diet that you're going to enjoy for the rest of your life.
Yeah, and the Facebook group is a great resource for combinations of what goes together, new things to try to spice things up and add more flavor. Now, Rebecca has a great question here. She was just diagnosed, stage 3B. She's GFR 35 to 40, has protein in her urine at age 39. As normal with kidney patients, she's super overwhelmed. Hey, we've all been there, Rebecca, and you're in the right place to help with that. And she's wondering, what should she focus on the most nutrition-wise? Where should she start?
There's a lot. When we talk about the renal diet, we do talk about a lot of factors. We talk about protein, potassium, sodium, we talk about fiber, we talk about fluids. There's a lot of things. So I get it. It can be a lot to focus on. One of the things that I love to look at first, and this is what we teach with the course, is the first thing we talk about is potassium. So understanding how important potassium is for you, understanding what it does, how it impacts your overall health, including your blood pressure, your muscle health, your energy levels even, that can all play a really important part. And the reason I like to address that first is because the majority of information that's out there on the internet is all about low potassium, avoiding foods, restricting things. And if you don't look close enough, you're going to miss that a lot of this information is actually about kidney failure patients, not chronic kidney disease. There's not a lot of stuff out there about the middle, mild or moderate stages of CKD. So make sure that you understand the information that you're getting, where it's coming from. There's a lot of dialysis companies that will put information out online to help people with the renal diet. But again, it's about a dialysis diet, which is very different. So understand, for example, where potassium is coming from and what it does for you, how important it is for you. I think that's one of the best steps to take, because that's just the one that comes to mind for me right away from everybody who says, oh, it has potassium, I can't have it. And my question always back to them is, why? Why can't you have this? Who told you can't have this? Because that's what you need to understand.
Yeah, and it should not be Dr. Facebook, Nurse Google, none of those for telling you what you should and shouldn't be eating. It should come from your healthcare team, because it's important that it is personalized for you. All right, Jen, we only have a minute left, and there are a lot of questions. Do you see any that you may want to jump on? The final question.
Ooh, okay. So it's recently popped up here that, is it Pina J? Thinking like pina colada. Pina J. Asking about fruits, a fruit fast. So what about fruit fasts, and are they good or safe for CKD4? But let's talk about like all the stages. Anytime that there is a diet, and I really want to emphasize the word diet, that talks about eliminating all different kinds of foods, all different categories of foods, that's a giant red flag. That's someone picking up this huge thing and waving it out there. Red flag alert. This is not a safe treatment method, because what we're doing with these types of very, very dramatic changes is it's creating Swiss cheese out of your nutrition profile. You are risking a lot of deficiencies by eliminating other foods. So yes, fruits are fantastic. And we talk about all the different options that we can have and include with the renal diet. But to say that you shouldn't have vegetables, you shouldn't have whole grains, you shouldn't have protein, because yes, CKD, all stages still need protein. You need to have these different healthy fats. You need to have these different food sources and food groups to give your body the nutrition it needs. Now, this is different than compared to, someone talking about fasting in general, which is going a window of time without food, like sleep, basically. But there's different ideas about that. Here I'm talking about any type of diet that's eliminating everything and saying, just have this. And I'll say bonus points or bonus red flags if they say, just take my supplement instead. That's another really big red flag, because they're trying to make money off of what they're telling you. They're trying to sell you something and say, no, all that food is not good for you. You should just take this supplement instead. That's not safe. It's not healthy. It's not a lifestyle change. And if you can think of making this change, let's just say you make this change for however much time, what do you think is going to happen to your body, to your kidneys, when you resume the diet you were on previously, right? Like, what's going to happen then? And what's the body going to do? How's it going to react? And do you think that it's going to say, oh, well, in that case, we're fine, everything's fine? Like, no, this is not, it's not a long-term solution. So I just want to really, really warn you, anything that's saying give up all these foods, not safe. Even that plant-powered kidneys, we don't say give up everything. We say a plant-based diet, meaning you still can have animal proteins, but you need to understand how they fit into your diet and that balance with everything else. So we are not a fan of getting rid of anything. The only thing we say get rid of is starfruit, because it has a neurotoxin that kidney patients should not be taking. You can't get rid of it. So no starfruit. That's the one thing that I'll say you can't have.
Very good. All right. We are at the end of our time for today's live Q&A. Now, Jen does things like this on the Facebook group also, plus people on her Facebook group, supportive, very positive. You can post things in there like, hey, I'm looking for a recipe, or kind of bored of eating this every day. What are some good ideas? You can look through things that other people are sharing in there and get lots and lots of great information. Plus, there's tons of videos here on YouTube that we've created over the years. Now, they're not always easy to find. If you go to the Dadvice TV YouTube channel, there's actually little tabs at the top, and if you click live, you'll see all the past live ones that we've done, and you can search the channel for different topics like salt. There were some questions about sodium. We talk about that. Milk, practically anything you could think of, we've probably discussed it at some point. Lots of great stuff. Doesn't cost anything, just your time to watch them. You can take notes and go back and forth, things like that. And Jen is here every month helping out, which is fantastic. We all appreciate her time so much. And as a kidney patient, my doctors are great, but the renal dietitian is the one key that made me not be afraid of food, to see that, you know what, I can do this. I can use nutrition as a tool to improve my quality of life, to make an impact on my health, to slow down the progression of kidney disease. All of that, for most people, can be done when you're working with your doctors and following a healthy diet that's individualized for you. All right, Jen, thanks so much for being here as always. And I will be back on the 20th of this month with Dr. Rosansky. So we got just about 2 weeks, and then I'll be right back. All right. Thank you all, and I'll see you all in the next video. Bye, everyone.